Hi guys, I'm back with a new case today. And before moving ahead, I would like to thank all of you for making our channel a family of 100 subscribers.
For all those who have recently joined my channel, I will add a link of the previous videos so that you can go and have a look at my old cases. Okay, so now let's move on ahead with our present scan. So today's scan is the post-operative scan of the case which we saw previously in the last video, if you people have seen, which was an extensive lesion, radiolucid lesion, I would say extensile radiolucid lesion in the lower right back region. So this patient has undergone surgery, that is partial mandibulectomy, or you can say marginal mandibulectomy, along with this reconstruction plate. Now if I move my cursor, now the question arises, what do we actually mean by marginal mandibulectomy? So marginal means a portion of the mandible has been removed. Mandibulectomy itself, if I split the word for you, it means that ectovy means removal. So a part of mandible has been removed. That's what the meaning of marginal mandibulectomy. So they have just removed a part. If you can see here, the mandible has been removed. This bone remains intact. That is the lower part of the mandible, inferior part, or the basal mandible, you can say. Moreover, they have removed the teeth, that is which were involved within this tumor. If you can see my cursor, that is 4, 5, 4, 6, 4, 7, these teeth have been removed. Okay, and along with that, they have placed this L-shaped plate. Now the question arises, what is something wrong here in this region? Okay, this is very good. This seems to be very perfect. It is very smooth. It is very well defined. The tumor has been removed. Plate has been placed. The things seem to be very good. But something is wrong here. Now what is this? This is ramus. Now if you see here on the left side, see, this is your entire jaw, that is the lower jaw, or you can say the mandible, the entire mandible. Now if we talk about the left side, so it's the left mandible. This is the body and this is the ramus of the mandible. Okay, that's a part of mandible which has been termed as ramus of mandible. Okay, now here you can see the bone is absolutely fine, no break is there, and nothing abnormal is there. But if you see on the right side, there's some break, there is, some discontinuity, I can see. And so let's have a look in the sections, to perfectly have a look what's wrong in this region actually. Okay. So I'll show you on the other slice, that is on the oblique slicing. I will go. Okay, this is my plate and this is my ramus. So here I feel something is abnormal. So what I'll do, I'll show you. Okay, now here I think you people can see here now. Okay, now this is a fracture line. Okay, there has been a fracture in the ramus of mandible. So if I say there is a oblique fracture, okay, which is running from anteriorly from the level of mid height of ramus and posteriorly to the base of ramus. Okay, this is the base. Okay, and this is the mid height. So there has been a fracture. So this is one part of the ramus and this is the other part. Okay, so what has happened is exactly that is the superior fragment. If I just move the sections, okay, now see my cursor, this is one part of the ramus, this is the superior fragment, or you can say the upper part of the bone. It has been one, and this is the inferior fragment. So ramus has been now divided into two, that is the superior fragment and the inferior fragment, and both of them have moved apart from each other. So it is an unfavorable fracture in this case which has happened. Unfavorable means that the fragments, they have been displaced.
Now, talking about the reconstruction plate, the screws at the posterior mandible, that is in the molar region, they are normally integrated or attached. However, if you have a look at the screws of the reconstruction plate along the ramus, the screws appear detached, or you can say they are separated from the bone because of the fracture which has taken place.
Now, the inferior fragment, this fragment we can see by the cursor, it is continuation with the remaining body of mandible. And if I talk about the upper fragment, that is the superior one, it has moved above. And there is a part of mandible that is, the condyle, coronal process, everything is attached to the upper fragment, and this is the inferior fragment. So, and this is your fracture line. It has affected this reconstruction plate now. That I'll show you in this section. See, you can see these are the screws of the plate. So the screws, ideally, whenever you have any plate, if you attach it, it has to be, entangled, or you can say attached completely with the bone where the plate is there. But here what's happening, this fragment has moved, and this place also, this plate also, so they are no more completely in contact. Now, if on the other hand, I'll show you later about the remaining plate, but here this is a case which has happened. This plate has moved apart, and it is no more in direct contact, or not well now attached with the remaining this ramus of the mandible. I'll increase the thickness and you will have a better view. Okay, here if I see, you can say, but these screws, they are no longer perfectly attached with your bone. Okay, this is because the bone has been fractured, so obviously, the fragments, they have moved. That's the reason. Now, so overall, what has happened is surgery has ultimately resulted in somehow the fracture of the ramus. Okay, and apart from that, now I'll show you something more. Okay, this is the superior inferior. Now if I move my cursor, you'll see many small fragments. Okay, I'll show you. This is one. Just see the cursor on the screen, 2, 3, and 4. So there have been multiple fragments of the ramus that has been fractured. 1, 2, 3, 4. So apart from the superior and inferior, the main fragments, this is the multiple small fragments which you can see here within the ramus of mandible. Okay. So this is all about the case today. That is, a final diagnosis what we gave here was unfavorable pathological fracture of the ramus of mandible. Why pathological? Because definitely it's because of the removal of the tumor. The bone becomes so weakened. Obviously, whenever anything is there, when any disease is there, it keeps on eating the bone, eating the bone. As a result, the bone becomes so weak that ultimately it has fractured when the surgery was performed. Okay, so definitely now do let me know your feedback, how you find the case, whether you have any doubts. So stay tuned, do like, share, and comment if you like this video, and your comments are most welcome. Please let me know if you have any queries about this case, about any other case. Stay tuned, and we will meet now in the next case some other time. Thank you so much.